Welcome to the deep dive. We've been seeing this incredible surge in mental health awareness lately. And as we move deeper into 2025, it's really clear more folks in Littleton are actively seeking professional support. It feels like a genuinely promising trend. So today we're going to sort of pull back the curtain on what that actually looks like for you. Our mission in this deep dive is really to map out the entire landscape of mental health care right here in Littleton. We'll explore everything. The different types of therapy available, the crucial details like costs, insurance, and importantly, your rights as a patient. Think of this as your shortcut, really, an informed pathway to cut through confusion and help you make confident choices for yourself or maybe for your loved ones.
That's right. And it's true, the therapists in Littleton are, well, they're really offering comprehensive evidence-based treatments. The aim isn't just a quick fix. It's more about helping individuals, couples, families build, lasting resilience to navigate those emotional hurdles with real foundational change.
Okay, so when we talk about this landscape, what are some of the most popular therapy services people are actually using in Littleton right now?
Well, couples and marriage counseling is definitely high on the list. Big demand there. The focus is all about strengthening relationships, really digging into communication patterns, conflict resolution skills. We see a lot of therapists in Littleton using approaches like emotionally focused therapy, EFT, and the Gottman method. And these are great for tackling common issues, things like trust problems, communication breakdowns, basically giving couples a real toolkit for connection.
That makes so much sense. Giving people tangible skills for, well, such a vital part of life.
Yeah.
And what about the more individual stuff like anxiety and depression? So many people seem to struggle with those.
Yeah, for anxiety and depression, the therapy is really focused on managing the symptoms,
Mm.
improving, the day-to-day quality of life. In Littleton, therapists are often using cognitive behavioral therapy, CBT, which is very effective. Also, mindfulness-based approaches and other specialized techniques too. What's maybe overlooked sometimes is how personalized these can be, tailoring the method to what that specific person is going through.
Right. And for people who've faced really difficult experiences
Yeah.
where trauma kind of lingers.
Ah, yes. Trauma and PTSD treatment. That's highly specialized work and incredibly important. Therapists use specific approaches like EMDR, that's eye movement desensitization and reprocessing, and also trauma-focused CBT, somatic experiencing techniques, things like that. The absolute key in these sessions is creating a really, really safe, supportive space. So individuals can process very tough experiences, heal without feeling, re-traumatized by the process itself.
That sounds like a very careful, empathetic approach. Necessary, I imagine. On maybe a different note, what about managing intense emotions like anger? That can feel overwhelming for some.
Right. Anger management therapy. It really focuses on teaching healthy ways to understand and control emotional responses proactively.
Yeah.
Therapists use cognitive behavioral techniques here too, helping clients identify their triggers, sure, but also develop effective, healthy coping strategies. It's about empowering people, giving them control over their reactions, not just, bottling things up.
That's a useful distinction. Now, one of the biggest shifts we've seen, especially since, well, the last few years, is online therapy. How does that fit into the picture in Littleton?
Oh, online therapy in Littleton has really changed the game for accessibility. It's huge. It offers incredible convenience, people getting quality mental health care right from home. Licensed therapists use secure video sessions, messaging support. It's flexible, which means it can actually fit into busy schedules,
Yeah.
while still keeping those high professional standards of care. Makes it a great option for a lot of people.
So, it sounds like whether it's for relationships, handling anxiety, working through trauma, or finding better ways to cope with anger, there's a specific evidence-based path available. As you're listening, maybe think about which of these services might resonate most with your own needs right now, or maybe just your interests. Okay, let's shift gears a bit and tackle the money side. The finances, because understanding costs is, well, it's absolutely crucial for making good decisions. This is where I think a lot of confusion can creep in, but getting clear on it can really empower you.
Absolutely. Costs are key. While the exact numbers will vary, of course, generally you'll see individual therapy in Littleton falling somewhere between, say, $120 and $280 per session. These are usually 45 to 50 minutes, maybe weekly. And the good news, individual therapy is pretty broadly covered by insurance. About 90% of plans cover it. Your copay would typically be around $20 to $40. And it's widely available. Lots of therapists offer it.
Okay, 120 to 280, 90% coverage, that's helpful. Are the costs similar for teenagers?
Very similar, yeah. Individual teen counseling runs maybe $110 to $250 for a 45-minute weekly session, covered by about 85% of plans, Copays $20 to $35, also high availability there. Now, where it gets a little more nuanced, maybe where you need to pay closer attention, is with some specialized therapies or relationship counseling.
Like couples counseling, I've heard that can sometimes be a bit of a sticking point with insurance. Is that right?
You're right on that, yeah. Couples counseling generally costs more per session, maybe $150, $350. Sessions are longer too, 60 to 90 minutes, often bi-weekly. But here's the important insight. Insurance coverage for couples therapy is, well, it's much more limited. Often only about 30% of plans offer any coverage, and the copays can be higher, like $40 to $80. So for couples, looking into other payment options becomes really important. Family therapy, interestingly, is a bit better covered, around 75% of plans, with costs between $140 and $300.
Wow, only 30% for couples. That's a really key difference to know about.
Mm.
Good heads up. What about the more affordable end, group therapy or online options? How do those stack up cost-wise?
Great question. Group therapy is definitely the most budget-friendly option. Typically $40 to $80 for a 60 to 90-minute weekly session. And get this, it's covered by about 95% of insurance plans. Copays are really low, maybe $10 to $25. And online therapy, as we mentioned, it consistently offers a more affordable way-in, usually $80 to $200 per session. Plus, it has high insurance acceptance, around 90% coverage, and that flexible scheduling. So yeah, if cost is a big factor, group or online therapy are often fantastic places to start looking.
That really clarifies the cost landscape. Super helpful. Now, related to cost is, well, duration. How long can someone typically expect to be in therapy? Is it always a long-term thing?
No, definitely not always a lifelong commitment. It really varies widely. Depends on your needs, your goals. Short-term therapy, maybe for a specific anxiety or a particular issue you want to tackle, might be something like 8 to 12 sessions. Medium term, for maybe depression or relationship work, could be more like 12 to 24 sessions. And then for more complex conditions or deep trauma work, long-term therapy might go beyond 24 sessions. And some people, even after making great progress, choose ongoing support, like monthly check-ins or maintenance sessions. What's really positive in Littleton is the range of payment options available to make therapy accessible. Most therapists take major insurance plans, Blue Cross, Blue Shield, Aetna, Cigna, United Healthcare, Medicaid too. But also, many providers offer sliding scale fees. These are income-based reduced rates. They typically range from maybe $50 to $120 per session for people who qualify. That's a huge help if insurance isn't great or you don't have it.
Okay, so even if insurance isn't perfect, there are other routes. Sliding scales? That's good to know. And what if someone decides to just pay out of pocket entirely? Any tips there?
Yeah, if you choose to self-pay, it's always worth asking about potential benefits. Some therapists might offer a small discount, maybe 10–15% for paying in advance for several sessions, or package deals. You might also find student discounts or senior discounts sometimes. Flexible payment plans are common too, like monthly installments. And remember, therapy usually qualifies for HSA or FSA accounts, those health savings accounts. And here's a nugget many people miss. Employee assistance programs, EAPs. Your employer might actually offer free therapy sessions right now. Many Littleton companies provide, say, 3 to 8 free sessions through EAP benefits. Definitely check with your HR department. It's often this underused resource that gives immediate, no-cost support.
That's a fantastic point about EAPs. Wow. Okay, so there really are quite a few ways to make therapy financially reachable. Sliding scales, payment plans, maybe even those employer benefits. It seems like cost shouldn't have to be the absolute barrier. There are options out there. All right, let's pivot now to something equally critical. Your rights and protections. Understanding these is just so important for accessing mental health care confidently here in Littleton.
Absolutely crucial. So, as of 2025, Littleton strictly follows federal mental health parity laws. This is a really vital legal framework. It's designed to stop discrimination in mental health benefits. What this means for you, practically speaking, is that mental health treatment is legally required to get the same level of insurance coverage as physical health services. Before these parity laws, mental health often got short shrift, fewer sessions allowed, higher copays. It made long-term care really tough for many. Now your mental health has to be treated with the same importance as physical health by insurers. It's a fundamental shift. Really opens doors to getting the sustained help people might need. It's a massive step forward for access and just fairness, equity.
That genuinely is significant. Treating the mind like the body in terms of coverage. And what about telehealth? We just talked about how much that's grown. Are there specific rules ensuring it's reliable and covered properly?
Yes, definitely. Littleton has specifically expanded access to telehealth for mental health under updated 2025 Colorado health policies. This expansion means you can confidently meet with licensed therapists through secure video. And crucially, you get full insurance reimbursement for it. So, that convenience doesn't mean sacrificing coverage. And beyond just getting access and coverage, patient confidentiality is Well, it's foundational. Littleton upholds strict patient confidentiality. That's under both federal HIPAA laws and state rules. All your therapy sessions, strictly confidential. A therapist can only share information if they have your explicit written consent, or in very specific, legally defined situations like imminent danger to yourself or someone else. But that's rare. That feeling of security, of privacy, it's essential for the therapy process to even work.
That reassurance is huge. Knowing what you say stays private is key for building trust. Absolutely. And what about the therapists themselves, their credentials? How do we know we're getting quality care from qualified people?
Good point. All therapists practicing in Littleton must be properly licensed by the state. And this isn't just like a quick check mark. It involves extensive education, rigorous supervised training hours, and they have to do ongoing professional development to keep their licenses active. This whole process ensures that the professionals you see meet high, consistent standards for quality care and ethical practice.
So these legal frameworks, parity, telehealth rules, confidentiality, licensing, they aren't just bureaucratic stuff. They're specifically designed to protect you, the patient. They expand your access to care and make sure the care is high quality. It's actually pretty empowering to know these protections is solidly in place. Okay, so we've covered the services, the costs, your rights. Now the big practical question. How do you actually find the right therapist for you? Let's talk practical steps and maybe tackle some common questions people have at this stage.
Finding the right fit is definitely key. And thankfully, many of the main therapy directories and platforms today have really good search features to help. For instance, platforms with detailed search options, kind of like you'd find on a good health directory site, let you search for licensed experts based on specific issues or specialties, and the treatment approaches they use. So you can really match their expertise to your unique needs. You can drill down quite a bit.
That sounds like it takes a lot of the guesswork out of just randomly picking someone.
Yeah.
What other ways can people kind of personalize their search for the right therapist?
Well, you can also usually filter therapists based on things like language preference, gender identity, maybe cultural background to help find someone you feel really comfortable with. And vitally, look for transparent therapist profiles. Good ones include genuine reviews from other clients. They should have detailed pricing info right there and clear details on which insurance plans they accept. All that transparency really helps you make informed decisions right from the start.
Okay, so you're looking for someone who specializes in what you need help with, fits your personal preferences for comfort, and works with your budget and insurance. It sounds like a much more tailored process than maybe people assume.
Exactly. It can be quite personalized. And just to hit on a few common questions people often ask when they start looking, like some listeners might be wondering, okay, what types of therapy are available in Littleton, maybe beyond the main ones we discussed?
Good question. We covered several big ones, but is there more variety?
Oh, yeah. Licensed therapists in Littleton offer a really comprehensive range of evidence-based treatments. So that includes individual therapy, couples counseling, family therapy, sure, but also specialized treatments for conditions like anxiety, depression, trauma, ADHD, eating disorders, a whole wide array of mental health concerns. The key is that the offerings are broad and they can be tailored.
Right. And the super practical question that always comes up, is therapy actually covered by insurance in Littleton in 2025? Let's just reiterate that.
Yes. Overwhelmingly, yes. As we talked about with those parity log, most insurance plans in Littleton are now required to cover mental health services. That includes all the major providers. And usually with reasonable copays, generally somewhere between $10 and $50, depending on your specific plan details, like your deductible. It's just much more accessible financially than it used to be.
Okay. And for anyone thinking about online options, that critical concern about security, are virtual sessions truly secure and private?
Absolutely. This is non-negotiable in the field. All online therapy platforms operating legally in Littleton have to meet strict HIPAA compliance standards. That covers digital security, privacy protection. It means your sessions use encrypted, secure connections. Your conversations stay confidential, period.
Okay, good to have that confirmed. Finally, for someone who feels ready, they want to take that first step, how soon can I actually start therapy? Is it a long wait?
That's a great final question, and the answer is often, surprisingly, very quickly. Okay. Many therapists can actually offer same-day or next-day appointments if you have an urgent need. For more routine appointments, most people can get scheduled within, say, 1 to 2 weeks. Especially now with real-time online booking systems that many therapists use, the barrier to just getting started, it's significantly lower than it once was.
That's really empowering to hear. Knowing how relatively easy it can be to start your own journey, with tools out there to personalize the search and get connected pretty quickly, The path forward seems much clearer.
And that was really our goal today, to give you a clear, informed path forward, try to cut through some of that potential overwhelm of information. We hope that with this knowledge, you feel much better equipped now to make decisions for yourself or maybe for your loved ones about mental health support here in Littleton.
Absolutely. And as we wrap up this deep dive, maybe here's a final thought for you to consider. Given these really unprecedented levels of mental health awareness we're seeing in Littleton and these strong legal frameworks ensuring access and affordability, what new societal shifts might we see next? How might communities start supporting mental well-being in ways that go beyond just individual therapy in the coming year? Something to think about.
Definitely something to think about, but for now, whatever your unique path looks like, starting that therapy journey, whether it's online or in person, it can genuinely lead to better mental health, a more fulfilling life. We really encourage you to explore the possibilities and, if it feels right, take that next step.